Hi, everybody, and welcome. Today, we're hosting a webinar on healthcare spending accounts. We have John Armstrong, who will be going through the OKA's Healthcare Spending Accounts Toolkit for members. John conducts government and stakeholder relations for the OKA and is also the chair of the Ontario Chronic Disease Prevention Alliance. Following John's presentations, we'll have a Q&A period, and any questions can be asked using the Q&A function on Zoom webinar. And with that, John, I'll let you take it away.
Great, thank you very much, Brenda. Welcome the opportunity to talk to you about health spending accounts. Just before we get going, however, I thought I would take a couple of minutes and just give everybody a little bit of a background on the work that I've been doing along with the Ontario Kinesiology Association as part of the board's focus over the last couple of years on third-party payers and on the insurance sector, which is what has led to this this seminar. So we've been working in the insurance sector really with a focus over the course of the last couple of years. OKA, along with later we brought in the CKA as well, and a number of the other provincial kinesiology associations, primarily because the insurance sector is national in its in scope, and as a result of that, sort of taking that broad national perspective, we felt was important. That being said, what we're going to be talking about today, as it relates to health spending accounts, is actually unique to Ontario, and it's unique to Ontario because in Ontario, kinesiology is a regulated health profession. So the overall program had been national, but some of the specific advantages that you have being a kinesiologist and regulated kinesiologist in Ontario are directly related to that regulation, and that's what gives you access to that health spending account. But as I was saying, we've been active in the sector for some length of time. And some of the information you're going to see as well is one of the things that we did is Benefits Canada, which is an organization that runs publications and a lot of continuing education seminars in the insurance sector. They do an annual healthcare survey in the private healthcare system, and to really get a temperature of where the health benefit sponsors, which are the companies and the unions, those people who sponsor the benefit packages, and the members, those people like us who have benefit packages, to get a read on what their interests are, what their priorities are, and because that helps to guide and direct the sector moving forward. And they have they do the annual survey. They have an advisory panel that interprets the data and interprets the survey results, that then goes into a report. So last year, actually, we participated as CKA and OKA on that advisory panel. It was a great opportunity for us, A, to get an inside look at the survey, B, to also have lots of conversations with, there were about 34 advisory panel members, gave us lots of good opportunity to have conversations with benefit providers. The group that sit around that table are actually on the sales side, sort of the senior salespeople. So it gives them so it was a great opportunity for us to have conversations with them, to follow up conversations with them as well, and to promote the role of kinesiology. But we also get an enormous amount of information out of that survey, and there'll be a little bit about that during this presentation as well. So just that's a little bit of background on what we've been doing. We've also been doing a newsletter into the sector as well, where we're continually talking about. We've done, I think, 3 a year for the last couple of years. We're going to do a couple this year. We might change it up a little bit. And that's just really to deliver the message about the value of kinesiology when added to benefit packages. Kinesiology and exercise probably also little more broadly. But anyway, the purpose of the health spending account toolkit is to provide you with a set of tools that you can use to make sure that your clients understand that they can use a health spending account to access kinesiology, to access their kinesiology services, and to pay for their kinesiology services. So that's really the core piece for the one of the core takeaways for you today, is that you can there's a set of tools here. It's really straightforward. There's no magic in it. It's just straight up communications marketing that you can use for your current clients, but also some things for potential clients as well. So what is a health spending account? Well, it's a flexible funding pool that's often used as a top up. They're getting more and more popular. It provides a lot of flexibility. So, where a traditional health benefits package would have, physio, massage, dentist, pharma, sort of has that basket. And that's the one that we've been interested in getting into. Only being regulated in Ontario has posed a bit of a challenge on that. Primarily because we have got it figured out to a certain extent, but in order to be in a non-taxable health benefit plan, 90% of the premium of that plan has to be on what the Canada Revenue Agency considers to be a non-taxable benefit. So kinesiology, because it's not regulated in anywhere except Ontario, is not considered to be a non-taxable benefit. It is in Ontario, but again, to get into the core package, you have to be it's offered nationally. So we're not considered to be a non-taxable benefit. We are actually a taxable benefit that makes us, for the most part, ineligible to fit into a base package. Now, there is 10% latitude, which we've been working with the sector on trying to fit into that 10%, and we are making some progress in certain areas, or at least I hope we're making some progress in those areas. But that's the kind of the traditional that's kind of the traditional health benefit package. But over the last number of years, health spending accounts have become more and more popular, and they continue to be. They continue to be popular. Health spending account is just it's a basic non-described lump of money or sum of money that a plan member can use on any service or product that the government of Ontario or the government of Canada, the Canada Revenue Agency, considers to be a medical expense, eligible on the medical expense tax credit. So in Ontario, kinesiology is that. Therefore, we qualify for health for the health spending account, and we could. Your clients can use that health spending account. So just to give you a little bit of context about the growth of them, health spending accounts in 2022, about half of the those who have benefit packages in Canada, about half of them include a health spending account. So right now, where I know some of the prevailing thinking is that because kinesiology isn't identified in the part of the base package, and specifically stated along beside physio and massage, that people don't have coverage. Well, as it would turn out, because of these health spending accounts, probably 50% of the people who come into your clinics or could use your clinics that have benefit packages actually have a health spending account that they can use. And you'll see in that third bullet, that's actually up from about 25% only in 2017. So the growth has really been significant over the last number of years, and I can also tell you that sitting around the that advisory board table for the Benefits Canada annual survey, the prevailing thinking is that the move towards more and more flexibility in benefit packages is only going to continue. So the sense of providing greater flexibility is probably going to be seen in a number of different ways. Some of the discussion that we had around that table last year was that also because of equity, diversity, and inclusion, and some of the implications of that as it relates to the benefit sector and kind of alternative forms of therapy and different cultural distinctions, may also be taking into account some of the added flexibility that we're expecting to see. So anyway, the bottom line is, as it relates to health spending accounts anyway, is that they are in high demand, because the other interesting stat out of that survey was that of the Canadians who have benefit plans but don't have health spending accounts, about 87% of them want one. So the demand is going to continue. So the opportunities for kinesiology services in Ontario to be covered by more and more organizations as they add health spending accounts is going to increase. So that is the very good news for registered kinesiologists in Ontario. So one of the things that we did is that we've done is we've developed a bit of a toolkit for you to use in order to communicate this to your members, also to work, or your clients, and also to work with your clients who don't have health spending accounts, to encourage their employers to add one. So what we've done is we have a bit of a toolkit. We've got a little toolkit for you in the members only section of the website. You'll see when you log into the members only section that there's a button on the bottom right corner where you see the arrow there that says advocacy update. And then when you get onto that advocacy update, it will give you they'll give you some background basically on what I've been talking to you about today. It actually also has the links to the Canada Revenue Agency, to a couple of locations on CRA, where you can see how you can see sort of where and why HSAs do work in Ontario and not in other places. Just as a quick background for that. So related to the question of because kinesiology is only regulated in Ontario, therefore it's a taxable benefit in other nationally. In order for it to be considered to be a non-taxable benefit, according to the Canada Revenue Agency, kinesiology actually has to be regulated in 5 provinces. So we're only in Ontario. We have to get to 5. There's been some momentum in Quebec. There's been momentum in BC, but you can see that it's a long road to hoe. Also, as it relates to regulated health professions, governments across the country have over the last number of years, really probably since kinesiologists became regulated in 2013 in Ontario, that there isn't the same kind of inclination to continue regulating health professions that there had been previously. In fact, there's a fair amount of discussion, not about deregulating anybody, but about sort of changing the regulatory model. There's certainly been some discussions in Ontario about that. There's been discussions in BC about that. So we're getting to 5 provinces seems like a pretty high hill. So, you know, as a result of that, the good news in Ontario is that the health spending account and the growing flexibility and that's anticipated in the health benefits sector is going to work well and going to be a good tool for kinesiologists. So that gives you a bit of a description, and then you'll see also at the bottom of that page there are I think 4 for additional links, and that's really those are the elements of the toolkit. I'll just go through those with you. So one of the things we've done is we've designed a poster there for you under the "We've Got You Covered" banner, and join the kinesiology movement today. That really talks about how HSAs can be used. So if you have a health spending account, to be sure to use it for your kinesiology services. So we have a poster that you could conceivably put up in your lobbies or foyers if you've got them, or use on a notice board. We also have a trifold brochure that describes health spending accounts and how they can be used, as well as a bit of a call to action for those who don't have them. Got a little tent card as well that you can actually put at your reception desk, or sort of perhaps at your counter if you've got a counter. Again, just reminding people to use their health spending account for their kinesiology services. And you'll also have a number of clients that obviously about half, according to the data at any rate, that don't have a health spending account. So one of the things that we've developed as well in that same toolkit is a draft form letter that your clients can use to send to their employers to ask them to add a health spending account. Basically, it has all of the same information in the letter that you'll see on the website, and a lot of the information that I'm talking about today, about how there's momentum for health spending accounts. They're growing, they're flexible. So it's something that you can also have copies. I'd recommend you have copies or email them to your clients if they don't have a health spending account to pay for your services, that they can then customize and send to their employer. We're also doing a social media program, sort of as part of our ongoing social media that we do with OKA, where we will be continuing to, and we often target we target the insurance sector and the corporate sector with when we run these posts that will that again encourage the use of health spending accounts, and also we're sending it out so kinesiologists can see it as well, so they will also know and learn and understand that probably half of the people with benefit packages who come through their door can actually have a third-party payer to cover off at least some of the costs. So that's light duty for us today. That's as much as I've got to say at this point, and I am happy to take any questions that anyone has.
So we do have one question asking to expand on how the regulation parameters are changing and how this affects kinesiologists.
There's been a lot of there's been more talk than action. I'm not totally current on where it is in British Columbia, but we're not anticipating it having any specific impact on kinesiologists if it happens. I mean, in Ontario, they've been talking about it for 4 years maybe, with no action. The last year they were going to be doing, they were looking at some additional changes, and then they did virtually nothing. But some of the thinking that certainly is swirling around in the provinces related to regulation is potentially collapsing the number of colleges and clustering the colleges together in order to create efficiencies. And then the other issue is some of the regulatory changes have also been motivated by some high profile, to be straight up, some high profile challenges related to doctors, nurses, and lawyers, and their regulatory colleges sort of not protecting the public the way that they are supposed to be protecting the public in certain circumstances, or at least there's been lapses of there seem to have been some lapses in their protection of the public, and there's demonstrated some concern that there may be some elements of conflict of interest as to whether or not the colleges are able to separate themselves from the profession enough to be looking after the public the way they should. So some of the discussion around regulatory change is really around potentially clustering professions together and changing that regulatory environment. For kinesiologists, particularly in Ontario, I think we would hope that it would have no impact on kinesiologists. Certainly that will be, that's been our goal. That will be our goal. Our position has primarily been to ensure that kinesiologists remain regulated in Ontario, no matter what, in order to provide all of the benefits, such as the one we're talking about today, to provide all the benefits that regulation can bring, no matter what the current or the structure is.
Okay, we have another question. Are there any particular insurance companies that consistently offer HSAs in Ontario?
Oh, that's a good question. I don't have an answer to that. That's a really that's a really great that's a really great question. It would normally be driven by the individual organizations asking to have the HSA added. So I'm not sure if there's any specific insurance company that would be that's more inclined to be adding an HSA. But that's a good one. I should take that back and have a look and see if there is such a thing. That's a great question.
Another question that we have is, how are we doing getting funding included for ODSP clients? How about OHIP post 65 years of age?
We haven't to date done any work on ODSP. I could look into ODSP, however, though I hadn't considered looking at ODSP, but I'll have a look at that. And as it relates to OHIP coverage, the likelihood of OHIP coverage, I think, is very slim. Slim to none, probably. The government's been loath to add more fee-for-service coverage. Look at the trends as it relates to WSIB and their programs of care and the motor vehicle accident system. They're more dealing with they make more efforts to try to design programs in the system now that where they can have more control over the costs, and fee-for-service OHIP doesn't provide that kind of latitude and that kind of control. So I wouldn't expect there to be any movement as it relates to OHIP.
Another question that we have is, do clients pay for service then apply to their insurance company for reimbursement? Do clients need to confirm with their insurance company before service?
If they have an HSA, they shouldn't need to confirm with the insurance company. I can't say it's universal for every insurance company, so you might want to do that once. But my guess is that it's probably not a requirement because kinesiology is regulated in Ontario, so you can use it. And sorry, I missed, what was the first part of that question again?
First part is, do clients pay for service then apply to their insurance company for reimbursement?
Yeah, I think I think normally that is the way that it works.
We have one more question here. Are we working with unions to include KINs in their benefit packages?
We have in the past. We haven't done an outreach to the unions in the last probably in the last little while. But we certainly have worked with the unions in the past. We've had some success. There's a company called Union Benefits that offer benefits to a fair number in the construction trades where kinesiology has been added. So we've certainly it is something that we've done some outreach in the past. But part of the challenge on the union side is that benefits packages normally have to be negotiated. So there's kind of a multi-step process where they you have to convince the union to add it as part of their bargaining, and then it has to be accepted as part of during the bargaining process. So we haven't put as much focus on it over the last little while as opposed to going direct into the insurance sector and try to make the case for the advantages of adding kinesiology to their benefits packages. One of the areas that we are looking at particularly is having kinesiology added. Hopefully, who knows how it's going to work? These things take an awfully long time. To be acceptable for the mental health dollars that are available for mental health, just because of the really dramatic and the very significant and important effects that exercise and the structured exercise program can have on people's mental health. But our focus has been less on the individual employer groups, whether they're unions or they're companies, and our focus over the last couple of years has primarily been on the benefits sector itself.
I do have another question. Is a physician referral required for HSA eligibility / CRA tax return eligibility?
Not to my knowledge, no.
On my end, I feel like we don't have any more questions. If anyone would like to ask any.
On the HSA eligibility and the CRA tax return eligibility. The one other thing actually that I probably should mention. So there are some people who have some very significant medical expenses, and so if you've got significant medical expenses that are not covered by either insurance or by a government program, and you're out of pocket, because kinesiology is a regulated health profession in Ontario. Any monies out of pocket that you might have for kinesiology can go towards the tax credit. I think the threshold might be $3,000. I'm not entirely sure what the threshold is right now, but anything over and above, I think it's $3,000 is deductible in your taxes, and so that includes kinesiology. And so if you've got a lot of medical expenses that are not covered in any way, and you exceed the $3,000, anything above that is a deduction, and so kinesiology is part of that that basket as well.
We have a bit more questions coming in. So is OKA looking to provide services in long-term care?
We certainly we're paying more attention. So this year we've moved to, we're not putting as much attention into the third-party payer world. We're pivoting a little bit more towards the towards the government and the public system, again, primarily related to the health human resources crisis, and long-term care is obviously one of the focuses that we will be working on.
Another question we have is someone mentioning, my sister got unions to upgrade chiropractic coverages by working with unions 20 years ago. Unions always tell us they love KINS. And a follow-up is, union benefits package for construction workers, is it part of HSA or independent?
It's independent. That's independent. And I know, unions do love KINS. I mean, when we were out a couple of years ago, we were getting some good reception. So it's certainly something that we could be focusing on again over the next little while. However, we are with the finite resources, we are turning some of our attention, as I said earlier, to the public healthcare sector, just because there's such a shortage of we've got some real shortages and challenges, as you know, in the public system, that we're hoping that we can work with the government to convince them to use kinesiologists more effectively.
Another question we have is, can we get a list of companies that include KINS and have HSAs?
We don't, the insurance companies don't give us that information. They won't, for confidentiality reasons, they don't divulge they don't divulge that information to us. So we don't actually, we don't have a particularly comprehensive list of the companies that have HSA or follow KIN. I know in some of the conversations we've been having with one of the insurance companies, there, the numbers of that have KIN in their plans is about 10%, so it's pretty low. But like I say, the HSA is really the right place to sit. But no, we don't have the numbers. We just have the aggregated numbers out of the Benefits Canada annual survey.
So currently we don't have any more questions, unless anyone is going to ask any last minute ones. And if not, we can wrap things up. So I guess I'll wrap things up now. Thank you guys. Thank you again to John for presenting the OKA Toolkit for HSA resources. And these resources, like we mentioned, can be accessed in the members only section of the OKA site. We will also be uploading this webinar if you guys would like to reference it in the future. Thank you all for joining us this afternoon, and we hope you have a wonderful day.
Thanks, everybody. Bye-bye. Thanks, Brenda.
Hi, guys.